We were talking about article in the Dayton Daily News in May, talking about cancer is now the area's #1 killer. Back in January, we did a couple programs, and it was about medical radiation. Is it a major cause for the increase of cancer? And what we shared with the listeners was basically our research over a year. And a lot of times, by us reading, and I found this, we've been doing this program now for about 13, 14 years. And if you are conscious and aware of the articles that are in the paper, they sort of like will lead you where we are going. And we put together this little outline. This was in June of 2009, where New York Times reported that a Philadelphia hospital gave the wrong radiation dose to more than 90 people with prostate cancer and then kept it quiet about it. Also, that same article said in Florida, a hospital disclosed that 77 brain cancer patients had received 50% more radiation than prescribed because one of the most powerful and supposedly precise linear accelerators had been programmed incorrectly for nearly a year. This was in June of 2009. In October, New York Times, there was an inquiry looks at overdose of radiation. This article has talked about California public health officials are investigating medical errors at Cedars Sinai Medical Center in Los Angeles, in which 206 patients were exposed to high doses of radiation doing CT brain scans. Hospital officials said patients got 8 times the regular dose of radiation doing CT scans, and that the problem went undetected for 18 months. This is a year and a half. The problem went undetected, that people getting exposed to this radiation. In November, an article in the U.S. News and World Report, government expert panel, routine mammograms before 50, not much use. In December of 2009, the FDA probes radiation at hospitals. The Associated Press, this is an article in Wall Street Journal. Federal health regulators are investigating reports of dangerous radiation levels at 2 more California hospitals following earlier unsafe medical scans at a LA facility. The FDA is probing the use of CT scans at Glendale Adventist Medical Center and also Providence St. Joseph Medical Center. FDA officials said they are investigating at least 10 reports of excessive radiation at these hospitals. December the 15th and 16th in Investors Business Daily and also the Wall Street Journal. The headlines were CT scans linked to cancer. CT scan could cause cancer. January the 24th, 2010, and this was an unbelievable article, and we spent a lot of time on this article. This was a front page article in the New York Times, and it talked about a life-saving tool turned deadly. Radiation offers powerful new cures and ways also to do harm. A very, very intense article that told about 3 different hospitals in New York and the pain and the misery that these people were going through. I just find it interesting that over the years that, the articles that we mentioned, if you follow, and, here's an article that was actually shared about the increase of CT scans and radiation that Michael had actually given me, a very in-depth about radiation and how it may be a major cause for the increase of cancer. And so the point in all of this that we can recommend to our listeners out there is what, Mr. Fred?
Well, the first thing is you know what you're getting into. Secondly, be willing to ask questions. Do not be afraid to ask questions to your healthcare providers. When you're being asked to do different screenings, begin thinking about what all have I done? Have I gotten any dental things? Have I gotten a bone density scan? Have I gotten any chest X-rays? How much exposure am I actually exposing myself to? as I'm going through these different tests and things? How many scans have I had? And then think about it over the period of time, over the last year and a half of your life. What's going on? And ask yourself, is this really necessary? And then ask your doctor, is this really necessary? Is there another way? And I wish there was some way that hospitals could be had some kind of accountability to patients as they come in for their things, to make sure that things are calibrated properly and stuff like that. But I certainly ask, when's the last time this thing been jacked?
We're going to come back because what you just mentioned, he has some points in here to ask. We have 2 callers, Michael. We're going to go to the call and try to get these in before we close the hour.